Good evening and welcome to Riding the COVID-19 Wave, Hope and Concern. My name is Bruno Tedeschi and I'm honored to host TAPinto's first signature event, which just happens to be a virtual discussion. Thank you for joining us tonight. I hope you will find this panel discussion informative. COVID-19 is a topic that has dominated our lives for nearly a year now, and while we are still in the midst of this pandemic, there is hope. There are promising new treatments available that we did not have in the spring, and as we all know, we have 2 new vaccines that were developed in record time, and there's a third being developed by New Jersey's own Johnson & Johnson. And beginning today, Governor Murphy has made the vaccine available to people 65 and older. So that opens it up to quite a few more people here in the state. So there is good reason to be hopeful. Before we get started, I want to thank our sponsors. Our presenting sponsor is Allergic Health. And we have some supporting sponsors in alphabetical order. They are the Bergen Newbridge Medical Center, Horizon Blue Cross Blue Shield, Prime Healthcare New Jersey, RWJBarnabas Health, and Trinitas Regional Medical Center. Before we get started with the discussion, I just want to review some logistics. Each panelist will provide an overview of their role in the pandemic. We'll follow that with a group discussion of the panelists, and then we'll open it up to questions from you. If you have a question, you can submit it with the Q&A function, which will be monitored throughout the event. So if you, at the bottom of your screen, you should see something called Q&A. If you click on that, you can type your question in there, and then I'll be able to see what the questions are, and we'll try to get to as many questions as we possibly can. Our event is going to be about an hour long. So let me introduce our panelists now, and I'll give you a brief bio of each panelist before they speak. With us tonight, we have Dr. Eric Perez, the Chief Medical Officer for Atlantic Health's Chilton Medical Center. We have Dr. Michelle Cholankeril. She's a medical hematologist and oncologist at Trinitas Regional Medical Center. We have Lori Colineri. She is the Senior Vice President and Chief Nursing Officer for the Central and Southern regions of RWJBarnabas Health. We also have Deborah Visconti. She is the President and CEO of Newbridge Medical Center. And Don Liss is the Vice President of Healthcare Management and a Chief Medical Officer at Horizon Blue Cross Blue Shield. So we're gonna start our panel discussion with Dr. Perez, who joined Atlantic Health System in 2014 as Chairman and Associate Medical Director at Overlook Medical Center in Summit. In 2016, he joined Chilton Medical Center to assume the role of Medical Director for Emergency Medicine. Dr. Perez has many years of medical leadership experience at institutions throughout New York and New Jersey. Dr. Perez?
Hi, welcome. I'm pleased to be here and share my time with you and answer any questions. I'm going to keep my comments brief so that we do have a robust question and answer session. And so both as an emergency room physician and as a chief medical officer, I have been able to both treat COVID patients directly, but at the same time, organizationally structure how we handle patients and how we position ourselves as a hospital. So I'm really here to give you the big picture, what we'll call the state of the hospitals. And I'm constantly asked, is it safe? Are you slammed? I heard, I saw, I read, someone tweeted me that, this is what's going on. And I'll be honest with you, just like the pandemic has been an emotional roller coaster, for our society, it's also been a little bit of an operational roller coaster, trying to run a hospital and more importantly, trying to take care of patients and doing it effectively. And I'm gonna go break it down to where we were and kind of where we're at. So to be honest, we had the spring, we had a lull in between the spring, and now we have now. So let's start with a little bit in the spring. And so much like this audience was likely having a lot of trouble finding toilet paper back then, we were also having trouble finding PPE to protect ourselves. Those are the gloves, those are the masks, those are the shields that you're all seeing and ubiquitous right now. You all heard the stories of this in the news. luckily at my hospital, and to be honest with you, probably all these hospitals on this call and in New Jersey, we were lucky in that we were consistently able to find that next shipment of PPE and supplies to keep ourselves and more importantly, our patients safe. And I have a lot of tremendous respect for the individuals in all our organizations who left no stone unturned to find us what we needed, regardless of the cost during that time. And so now, if you fast forward to today, just like you can find toilet paper on the shelves, we're also finding PPE more easily. And that allows us to care for a lot more patients in more areas, which improves your health. And I can't underscore how important this is. It means that more doctors are open, more surgical centers are open. There's more places for us to deliver the care that you need where you need it. So let's go back to the spring again. At that time, to be honest, our hospitals were overflowed with COVID patients. And to be honest, not much else. Everyone else stayed home. Some were altruistic. They didn't want to get in the way of us taking care of other patients. A lot were just plain scared, and they didn't want to come to what they considered the epicenter of the pandemic. And that was understandable. The pace of COVID patients in the spring that was arriving at our doors was tremendous. It seems like we diagnosed our first patient, we blinked, and we were at 100. And that just kept continuing at that time, and you all saw those stories. But then after the wave was over, we were in a lull, which was equally difficult to manage because we were overwhelmed with patients and suddenly we had none. While our COVID patients went down dramatically, we had this double whammy where none of the patients who normally come to get care came to our hospitals. Our emergency rooms were empty, hospitals were well below their traditional volumes, and you were hearing reports of possibly physicians and nurses having to be laid off because there wouldn't be enough work. Fortunately, that's not the case, and the hospitals are full again. But this time it's much different than the spring. We're full, but we have a very good mix of patients. We have some COVID patients, but most of our patients aren't COVID. Between the achievements that you'll hear about in some of the treatments of the disease, between some of the social behaviors that we've pretty much mastered as a society, and anticipating some of the complications and some of the roadblocks of treatment, the hospitals have really managed to keep our patients healthier and get them home sooner. And also the pace of the patients arriving at our hospitals is a little bit lower. So all in all, in terms of that answer, should we stay away from the hospitals, what's it's like, it leaves us at a position where we're busy, but to be honest, we're more than capable of taking care of your patient needs. And this is one of those kind of public service messages where we really shouldn't be delaying your care any longer. We really perfected ways of keeping you safe at our facilities. And staying away is frankly impacting your health. Missing mammograms and colonoscopies, it's going to lead to cancers that we can't diagnose and treat at an early stage. We have to get back to taking care of ourselves. We'll hear more from the rest of the panel, but as you heard from Ted, we're looking into how do we get back to to what was normal. So we can freely enjoy many of the things that we once did. Vaccines, kind of give us a glimmer of hope that this can happen. But to be honest, on that journey, and while we can discuss how we're going to get there, we have to take care of ourselves now to make sure that we can enjoy what's coming on the horizon, because I do believe it is coming on the horizon. And with that, I'll leave it off to the next panelist so that we have time for questions.
Thank you, Dr. Perez. Let's now turn to Dr. Cholankeril, who began her association with Trinitas Regional Medical Center while in high school as a volunteer, and she continued shadowing attendings in the ICU as a medical student. So she has really come full circle and returned to Trinitas, where she feels she can serve the community where she has grown up. As I previously mentioned, Dr. Cholankeril is a medical hematologist and an oncologist. That's someone who deals with cancer. Dr. Cholankeril is going to tell us how she went from a cancer specialist to a COVID specialist. Dr. Cholankeril.
Thank you so much. So, my name is Dr. Michelle Cholankeril. I am the Division Chief of Medical Oncology at the Trinitas Regional Medical Center, and I'm also a member of the Medical Executive Committee at Trinitas, as well as Principal Investigator and Sub-Investigator of Oncology Trials. So I guess the question here is, how did an oncologist, hematologist get involved in the COVID realm? And I will tell you that I'm not the only oncologist in the nation that this has happened to. We are also trained internal medicine physicians, so we're all triple boarded. So it only made sense to help out when the need was there. At the end of February, the beginning of March, we were beginning to see a new virus taking on the whole world. It was new, it was acute, it was unknown. And overnight we were wearing masks, wearing PPE, really doing things on the floors that we weren't used to doing, or nor were we trained to do. And before we knew it, our colleagues were getting sick from this infection. And when that occurred, we had to really place our internal medicine hats on and come help out on the medical floors and start taking care of COVID patients alongside the cancer patients that we were dealing with. And, in the world of oncology, we are used to end of life discussions, palliative care, terminal illnesses, but this is something that was even new to us. And we knew that seeing these patients alone, helpless, lying in rooms all by themselves without any family to be around, just wearing PPE and putting them on ventilators didn't seem like that was enough. So we kind of went to what we knew how to do, was find clinical trials, recruit patients, enroll patients on ventilators and non-ventilators with their families' help. And that's exactly what we did with our oncology clinical trial team, who was fantastic. So we quickly were able to find clinical trials that are now well known, I feel, to the United States, whether it be the Gilead remdesivir trial, the Mayo Clinic convalescent trial. We had a stem cell trial and various monoclonal antibodies that we had used. I did grow up in this whole Trinitas society through all my life, and Trinitas serves a minority-rich population. And statistically, we know that COVID affects Hispanics and African Americans with higher death rates than all Caucasians and other members. So if we did not act fast, we would be in big trouble. So with that being said, we felt more prepared when we had more things to give them, whether it be steroids, figuring out how to wear PPE, placing people in prone position on ventilators. There was a change, and then we began to see the decrease in patients, and that made us felt that the therapeutics were actually working. People were actually isolating, and it made us feel more secure when we were rounding on these patients. It was tough to see patients lying in rooms by themselves, but I feel now that we are at the second surge with medication, with COVID vaccines ourselves, we've received COVID vaccines. I think we feel more prepared to walk into these patients' rooms because we have something positive to finally give them while we are now working back with our cancer patients. So it was really, from a clinician's point of view, it was a devastating experience. It was new for all of us, but I think we are now, with a nice lull. It was nice to see a lull, and with this mild resurgence, I think we're going to feel better about how we care for the next few weeks.
Thank you, Dr. Cholankeril. We're going to turn now to Lori Colineri, who has been a nurse for many years. She works for RWJBarnabas, which, as most people probably know, is the largest healthcare system in the state of New Jersey. Under her leadership, RWJBarnabas has developed a collaboration among all levels of nursing across all their campuses. She's come together to develop and refine shared governance, the nursing practice model, as well as nursing philosophy. And she works to leverage the nursing team's diverse background to foster a collaborative, supportive working environment. Lori?
Thanks so much, Bruno. Appreciate being here. And this is so important, to our community and to all of us in healthcare. The response of our nurses and our physicians and our pharmacists, and I have to say all of our ancillary support services in any hospital, such as our environmental services workers, our dietitians, our case managers and social workers, and even our engineers, our informatics and IT folks. The response of everyone together was more than Herculean. And this is not just at RWJBarnabas Health, but I have to say across healthcare in the state of New Jersey, every single one of us here today, as well as across the nation. It's been remarkable. It takes a village on a normal day, but in the face of a pandemic like this, the teams really had to come together in a way that was unprecedented. And they needed to come together, and we all had to devise new ways to take care and take best care of our community. We had to rely heavily early on on our recommendations from the CDC and basing our treatment protocols and our medication regimes on the science. And this took time, but it forced us to be nimble. It forced us to be very, very nimble and keep up with the changes, these rapid changes that we saw early on. Very difficult to do, but we did manage to do it. I'm so proud of it. You know, and our teams needed to be educated and re-educated, retrained, trained again, PPE, different types of technology, different protocols, and some had to even do roles and take on roles that they've never done before. And they had to do this to keep protecting themselves and protect our patients and keeping our patients safe and keeping ourselves safe so we wouldn't contaminate each other and we wouldn't become sick ourselves. So at RWJBarnabas Health in early March, you know, going back to the spring, around the 13th, I have to say, I think we had about 8 COVID patients, just 8, but we knew the tsunami was coming. Within 2 weeks, we had across our entire system over 1,000 patients. These cases that came to our hospital, you know, as some has said prior, were highly sick, were really sick. They required ICU level care. They required ventilators. You know, but as we fast forward to today, the good news is that, you know, with this second wave, our patients are far less acute, thank God. They're not requiring, many of them are not requiring ICU level care. We're keeping them out of ICU, and that's because we largely due to our more rapid testing and confirming positive cases early on, catching them and onboarding those treatment protocols and all the medications really early in the disease process. And it really has helped to get us and keep that flow going and keep getting patients out of the hospital quicker. You know, during this time, one of the most difficult things that we had to do was to limit or suspend our visiting hours, and knowing though how important family visitation is in the healing process. That support is extremely important. We became the family. Our staff did everything to continuously work to connect the patients with their family. We early on, our nurses and our clinicians took their iPhones and they would do FaceTime with the patients and families. And we got generous donations of iPads. We used telehealth, and we also, you know, celebrated every single one of the successful outcomes that we had. And, you know, as you saw on TV, you saw us, we did the same, lined the hallways, clapped patients out as they were discharged. But, you know, we also were there for our patients during their time of loss when we were losing them. During that, we grieved with our families. We held their hands. We were the ones who helped our patients in that very, very difficult time and transition when we lost them. This takes a tremendous emotional and physical toll on our staff, no doubt. As a leader, this is what keeps me up at night, the resiliency of our staff, and how will we be able to get through this pandemic, and will we ever be the same? This weighs heavily on my heart, and our staff is so selfless in what they do. They have made personal sacrifices every single day to make sure that they're doing all they can to take great care of our patients. And I'm so proud, you know, of each and every one of them. I'm so proud of the clinicians across our entire system and across our state, at every single one of our hospitals in our state and around our country. But, you know, what's most important is the community support, I have to say. That's really what keeps us going. It's your support and the people who are here today to listen to, you know, what's going on. Your support's so uplifting. You know, so many of you have given so much to us as we, you know, day in and day out are caring for our patients during this crazy time. Your food, your prayer, your support and acknowledgement has really been uplifting, I have to say. And, you know, that recognition for our work and you calling us heroes, you know, sometimes I get goosebumps, and sometimes I think, you know, it's kind of hard for us to think of ourselves as heroes. Our staff sometimes has a hard time with that, and they've said that to me time and time again. It's a little difficult because we think of heroes as being people who save people, right? You know, while we've had treated and we've had such great success, I have to say, and we can say we've had success, we also have grieved for so many that we have lost because of this horrible pandemic and virus. We are working diligently on vaccinating our staff, and we have great staff support for vaccination. We're working on preparing to staff to our vaccination clinics in the community when that time comes. And we can only just impress upon everyone to really continue to mask, continue to wash your hands, continue to stay safe and social distancing. And that is what's most important, and that's what's going to keep us going and get us to the end of this, this pandemic.
Thank you, Lori.
Thanks.
We're going to turn now to Deborah Visconti, who is the president and CEO of the state's largest hospital. I actually did not know this before today, not before we spoke earlier. It's Bergen Newbridge Medical Center. Deborah is a thought leader in healthcare in New Jersey with more than 30 years of experience. Under her leadership at Bergen Newbridge, the hospital has expanded programs, services, and enhanced provider relations, yielding improvements in quality, safety, and patient-resident experience. Deborah?
Thank you, Bruno, and thank you for hosting this and having me on the panel. It's a true honor, and welcome to all of our participants, our community. Thank you for listening to us. As Bruno said, I'm Deb Visconi. I'm the president and CEO of Bergen Newbridge Medical Center. We're like every other hospital for the last year, been under siege by this pandemic. As the county hospital, a public hospital in the state of New Jersey, located in Paramus, we have a unique position in our community. We are actually 4 hospitals under one roof. We have a full service acute care division, which is where all of our COVID patients came. We have, with a 24-hour emergency department like every other hospital. We have a very large behavioral health division. We have a large substance use and addiction medicine division. And we have the largest nursing home in the state of New Jersey under one roof. So we had, like every other hospital, and you heard it from my colleagues on the panel, really a lot to change and pivot the way we took care of our patients in order to handle the pandemic. But we were also in a very unique position to be able to handle the entire continuum of care for our communities. We never closed our doors to behavioral health patients or substance use patients that needed to come into the medical center to access care. We were able to provide care safely and very uniquely in right on our campus. And that really set us apart in many different ways, because the way I looked at it and my staff and my team was, there was a pandemic. Within the pandemic, there was an epidemic. And that was the epidemic of opioid addictions and opioid deaths that still continued in our community, and the mental health and behavioral health diseases that were still out there and actually becoming more and more prominent as a result of the pandemic. And we were able to continue to care for those individuals within the pandemic environment. Our long-term care facility, over 500 long-term care residents, call Bergen Newbridge Medical Center their home. And as you all know, that was a very vulnerable population and continues to be a vulnerable population during the pandemic. And so our ability to safely care for those individuals really demonstrated a success in assuring their safety and well-being during the pandemic. What I wanted to focus on tonight was what I'm calling the COVID trifecta. And that is, where I say the hope is for all of us. And the trifecta is first, test. Test, test, test. Test yourself often. There's multiple testing sites throughout New Jersey. Bergen Newbridge Medical Center is in partnership with the County of Bergen, running a drive-up testing site out of Bergen Community College. We have all testing available on our campus, so access to testing is available, and we encourage everyone to test themselves often. Number 2 is vaccinate. Vaccinate when it's your turn. And you already know that that turn is coming sooner than we anticipated. The priority groups are opening up. And so the vaccines are available, and we encourage you, when it is your turn, to get vaccinated. And the last thing, the third part of the trifecta, is to manage your health. Make sure, and you heard Dr. Perez speak about this earlier, make sure you take care of your health. Make sure you do your routine screenings. Make sure you come and see your primary care doctors, your specialists. Hospitals are a safe place. In fact, the hospitals are probably the safest place. We know how to take care of people that are sick. We know how to care for those throughout the pandemic. Our infection prevention procedures and policies are perfectly implemented. Our staff knows how to protect themselves and anyone coming through our doors. Our staff wear masks while they're on premises and wash their hands often. Our facilities are physically distanced, so it is safe to come to hospitals. What is not safe is not to care for yourself, because if you don't go through your screenings and your normal, routine, once you get sick and then things become critical, and then you end up in our emergency rooms, and that's just not good. We want you to take care of yourselves. And so, we are second wave. We are in the middle of vaccinations. And that's an incredibly great moment for all of us to have access to that light at the end of the tunnel, because the light is bright and it's here and we need to embrace it. But please make sure that you think about the trifecta: test, vaccinate, and take care of yourself. Thank you.
Thank you, Deborah. That's hopeful. Finally, let's hear from Dr. Don Liss in his role at Horizon, which is the state's largest insurance company. Dr. Liss leads the staff to promote the delivery of safe, effective, patient-centered care to over 3.5 million people enrolled in employer-sponsored public sector government programs and individual health plans. Dr. Liss?
Let me start by thanking my fellow panelists, their colleagues, and their counterparts at hospitals and healthcare facilities across the state for the remarkable job they did caring for New Jersey. The resilience they've shown, their ability to adapt and figure out how to take exquisite care of not only those with COVID-19, but the rest of the spectrum of healthcare while we're in the midst of this pandemic is quite admirable and needs to be recognized. Back in March, which seems a lot more than 10 months ago at this point, I had the privilege of leading Horizon's efforts to respond to the coronavirus pandemic and continue in that role today. We had three primary objectives. One, first and foremost, was to make sure our members, the 3.5 million people in New Jersey that count on us, had access to safe and effective healthcare, to make sure that we were paying claims efficiently and appropriately to keep the healthcare system going, and to make accurate information available to that population that counts on us. And that last activity is going to become even more important as confusion and challenges around the emergence of vaccine are affecting all of us and our families. In the category of access, a couple of things I want to point out very quickly. Within the latter half of March, moving to eliminate any barriers to receiving appropriate care. At that time, the most important care was testing, when testing was quite challenged and very limited. But making sure that there were no concerns like out-of-pocket costs, co-payments, deductibles, co-insurance, and the like for testing, for services that resulted in testing, so evaluation, and then for treatment of COVID-19. We needed to make sure that our members weren't avoiding care, weren't, frankly, staying in the community and putting others at risk for fear of the financial consequences of seeking care. The second area that was incredibly important early in the pandemic and continues to some extent today was access to telehealth. That is, making virtual care available when it was challenging and frankly inadvisable to seek care in person. The dynamic has changed considerably, but there's still a very important place for telemedicine and telehealth in seeking care. And COVID-19 is probably going to ultimately be an inflection point in willingness of doctors and hospitals to deliver that kind of care, and willingness of patients to accept that. Finally, one special case of telehealth is in behavioral health care. Behavioral health care was an incredibly delicate situation early in the pandemic when, frankly, therapists and behavioral health providers struggled mightily to continue to provide care to a very vulnerable group when it was all but impossible for them to see their patients in person. Obviously, the most critical behavioral health services that needed to be delivered in person continued to be, but outpatient therapy especially was challenged. And the resiliency and ability to adjust by the behavioral health community was very impressive. Horizon made sure that telehealth was available without barrier, was available without out-of-pocket costs, and created capacity for episodic telehealth therapies, even by individuals, by physicians who weren't an individual's regular physician for urgent and episodic circumstances. Again, as I mentioned, with the advent of vaccination, there's even more challenges to making sure that access and availability is there, and certainly Horizon sees its responsibility to do so. Bruno?
Thank you, Dr. Liss. So let's begin our panel conversation. I'm noticing that we're getting lots of questions, so I'd like to get to as many of them as we possibly can. In the meantime, before the question, I just kind of want to throw out my own question, which is, and I think this is probably on a lot of people's minds, when are we getting back to normal? And what is it going to take to get back to normal? I've heard something called herd immunity. What is that, and are we on our path? Are we on the quick path to get there? How long before we can stop wearing masks, till our kids can go back to school, till we can have parties, all the fun stuff that we all miss? Anybody want to tackle that question?
Well, I can answer the question of what is herd immunity. Herd immunity is really when a large group of people become immune to a disease. And once you become immune to a disease, spreading it becomes less likely. Unfortunately, right now, our transmission rates for this and these new mutational variants are so high. So until we begin to see a decrease in cases, a decrease in deaths, I think we have to follow and track these numbers. I think we're going to have to see how people do 1 month, 2 months after vaccines. And hopefully sometime in the very near future, we're going to see that we're not giving this infection to other people. And if we're not giving this infection to other people, then we've captured herd immunity. Unfortunately, or fortunately, with this vaccine, we may need almost about 65% of Americans to get the vaccine so we can get herd immunity. So I think that's going to be our challenge. And I think masks and hand washing and sanitizing is going to be here with us for a very long time.
Yeah, Hi, this is Deborah Visconti. I would definitely add to that, that it's going to be several months, better part of 2021, quite frankly, from what we're seeing. I mean, there is light, right? So the vaccines are here, but even once you take both doses of the vaccines, you're still going to have to continue to wear your mask properly over your nose and mouth, because you can potentially still spread the virus through your respiratory tract and you won't know you're spreading it. So a mask is going to be with us for a while. I think we are going to start to see more opening up of society, schools and sports and, restaurants, but it's going to be, I would say, the better part of the year before, normal as we knew it before the pandemic.
Anybody else want to tackle that question?
I will just say that we recognize, in healthcare, we always get questioned by, our family and our community and our friends. When is it going to end? And I think everything, that Michelle and Deb said tonight, is we need to really just take pause and appreciate. It is going to take time, and staying vigilant, staying diligent to what we know to be what helps us, which is masking again, which is masking and staying away from large crowds and being very diligent in hand washing. We always preach that when we wanted to not spread the flu around. And now, with the masking, we're seeing our flu rates, which are non-existent basically. And we're really can know and take that as a positive sign. But, we really do have to stay the course, and it is going to take time. And, people want this magic wand and want it to all go away, but we've been very patient, and some have not been patient, but we're going to need to be patient through 2021. It's my feeling.
Okay. Here's some questions that were submitted by the folks who are watching us. One person asks about their sense of smell. They've had COVID and now they can't smell anything. As someone who had COVID, I know that feeling. It's really you don't think much about smell, but when you lose it, it really does affect everything. You can't taste anything. It's horrible. So what is there anything that someone can do to help them regain their sense of smell? Is there some therapy? Is there, or do you just wait?
I think I'll tackle that one. I think unfortunately we're in the just wait category. The majority of people have been getting their sense of smell back, some within as quickly as a week, others has been months, of this, and gradually versus all at once. There's no real formula for it, but to our knowledge, we have no magic cocktail to get the sense of taste and smell back.
Okay, I have a question that somebody asked about breastfeeding women and getting the COVID vaccine. But before we get to that question, can I ask the more general question about the safety of the vaccine? As you probably heard, have seen in the news, there's a lot of people who question the safety of the COVID vaccine. Can you speak a little bit about before we get into the specifics of who is it safe for and not safe for, but just in general, do you feel confident that this is a safe vaccine, both versions of it? It was developed very quickly, and I think that may put a lot of people on edge, that how quickly it was developed. Do you feel it is in fact safe?
Yeah, so I'll tackle that one first. I absolutely think it's safe. I don't think the speed necessarily has to do the development speed of a vaccine. To be honest, we've had this technology in our back pockets for years. We just never had the opportunity to use it because it is expensive and we didn't have the ability to put it out. And vaccines in general are not a market where companies can make a lot of money on. So this type of mRNA technology has been there, it's been developed, and it's a very pure and clean technology. To be honest with you, for those of you that are, the biochemists and the molecular biologists, this is like a dream come true. It's kind of a little bit space age technology. So the speed at which it was developed doesn't bother me in the least. What I think people are talking about is the amount of time since we've injected people and the amount of time we've been able to observe them. And they are correct in a sense that it's only been about 10 months with both of those vaccines. That being said, what we've seen in those 10 months has actually been pretty remarkable. And being someone, I've actually read the entire EUA on both the Pfizer and the Moderna vaccines. The amount of adverse reactions they have, and having looked at previous types of documents like that, actually a very, very clean, safe profile. And I think one of the things that you'll see is, I think amongst almost all of our institutions, I know certainly amongst mine, the physicians have been the biggest adopters of taking the vaccine. And it didn't start that way. It really didn't. We were some of the most skeptical groups saying the same exact things that everyone's saying. It's coming too fast. We don't know what it's doing. I haven't seen anything. And more than anything, we've all been like, show us the data. We all believe the data. And then finally the data came out and we went from like a 20 to 30% of the doctors wanting to take the vaccine to close to 100%. I mean, they are vaccinated across the hill. So, you know, in terms of that, and do I think it's safe? I've got 2 shots in my arm already. So yes, I think it's safe.
Yeah, so I'd just like to add to that. Agreed, you know, it's safe. So mRNA vaccines have been around. It has been used in cancer patients. So the fact that we are attempting to use mRNA vaccines in some of our sickest population of patients suggests to you that this is something we are looking at in patients that lack an immune system. Now, this is not the polio vaccine or the tetanus, typhoid, or pneumonia vaccine. This is not a killed or a live virus. It's an mRNA virus. And what that makes me feel better to know is that this is not going to enter cells. It's not going to enter inside of the nucleus and damage my DNA or give, you know, my future children birth defects or enter my breast milk if I choose to breastfeed. You know, as a young woman that myself is of childbearing age, these are things that I thought about for myself and also for my colleagues. And just as much as physicians are pro-science, we are some of the biggest skeptics of science. We do need data to understand and know what we are going to do for our patients, because at the end of the day, we have to relay this information to our patients. So I feel very comfortable having lupus patients, cancer patients, those on chemotherapy, those looking to get pregnant, take this medication. Does it have side effects? Of course, it's ramping up your immune system, but is it an actual virus? It is not that.
And just to get back to the question, it sounds like you've answered it, but I just want to make sure we explicitly answer it. In terms of breastfeeding women, it is perfectly safe. I thought I heard you say that.
I did. So the American College of Obstetrics and Gynecology, it is not a contraindication to be pregnant and receive the vaccine, for breastfeeding women to have the vaccine, for those looking to get pregnant to get the vaccine, because once again, it does not enter the cell nucleus.
Great. We have a question about as we all know, there are 2 different versions of the vaccine. There are 2 different vaccines, one made by Pfizer and the other made by Moderna. One person asks, is there a preference for one over the other? Is one better than the other? And I'll throw in another question, because I've heard a news report that, as we all know, the virus is mutating. And I did hear a report that the Pfizer vaccine can handle the mutated virus. I haven't heard anything about the Moderna, but if people can have a choice between one or the other, should they be trying to get one or the other?
Bruno, as a practical matter, one, it's unlikely that people will have a choice, frankly. Each facility that's administering vaccine is likely going to be using one or the other. And the recommendation is they're equivalent. Whichever one is available is the one you should take. With regard to their published efficacy and safety profiles, they're nearly identical. They're for every practical purpose, they were equal in clinical trial outcomes on the side effect side and on the effectiveness side. The issue, whichever one is available is the one you should get. That's how I'm going to do it.
Another question that people have about the vaccine is, if you had COVID, you have the antibodies. Do you still need to get the vaccine? And if you do, how long should you wait before you get the vaccine after you've tested positive for COVID?
Mm-hmm. So at this point, both studies suggest that those with COVID take the vaccine 90 days following symptoms, assuming that antibodies stay in your system for approximately 90 days. Some antibodies can stay for as long as 6 months to a year, but at this point, we're saying 90 days following your infection, or if you were found to ever be positive. And That being said, I think another question that I'm just going to kind of jump into is if you receive vaccine number 1 and then you find out that you have COVID, what do you do with dose number 2 is like a frequently asked question we get. And I will say, we pause, wait for the 90 days, and then give the dose. You don't have to start from scratch. If you have antibodies from COVID and you have it from a vaccine, you're going to have really more than enough at that 90-day period to get that second shot. So you don't need a total of 3, as far as we know right now.
Anybody want to add to that? Okay. I have a question from a skeptic who asks whether asymptomatic spread is really something. Is that really something true, or is that something that? So asymptomatic means that you have the virus, but you don't have any symptoms of the virus. Can you still spread COVID?
I'll handle that one. So I think there's 2 forms of this asymptomatic spread. And one is what we call kind of pre-symptomatic spread, which I think probably is a lot more likely. And that means you have COVID, but you haven't shown symptoms yet. You're going to show symptoms. Those symptoms may start on day 4, may start on day 5. You're considered infectious, a day or 2 before that. So that's what we'll call the pre-symptomatic. We know that from a lot of disease processes. Those people can be tremendous spreaders, even though they don't have it. So they are asymptomatic at that point. They are someplace, but they're able to spread. There's also this group of people that we have with COVID now because of increased testing, which we're referring to as, complete asymptomatic, meaning that they're asymptomatic. They're only testing because someone else that they're in contact has been tested, or because they're worried and they test positive, and they don't have a single symptom whatsoever. Okay, those people can also probably transmit. Probably they're not as big of a transmitters as the pre-symptomatic patients, the patients that are eventually going to get symptoms, but nonetheless, we think that they can transmit as well.
Okay. Question, again, another cynic. They are questioning whether or not, let me just read you their question. It says the stats are showing that people who die from COVID, as we know the stats every day that come out, but they want to know, are these numbers just being attributed to COVID, or is this in fact something that I guess they're kind of asking, are these numbers being fudged a little bit to overstate the impact of COVID? Anybody want to tackle that?
I believe the numbers. I have every confidence that the diagnosis is being made, and the record keeping and all of the diligence in attributing outcomes to COVID are accurately being recorded in hospitals. Speaking from the perspective of Horizon, when we get a claim for COVID-19 infection, we handle that claim. We believe the diagnosis as it's presented and process it accordingly. There is absolutely no reason to believe anyone is fudging these numbers.
Yeah, I just will add, our state has imposed upon all of our hospitals very strict guidelines and parameters and definitions for reporting all of our patient types, whether they're a person under investigation or a PUI or a positive COVID and death, with very distinct definitions. And we've reviewed them. We have teams of people who are combing through all of our records, who have to report and report daily. There is a reporting mechanism in place. So yeah, I agree with Don. We believe the numbers are true. We've done a lot of work. There's teams of people doing a lot of that work to report very accurately those numbers.
Good to hear. One person has a question about getting COVID again. I think we've all seen news reports of some people saying they've gotten it a second time. Is that possible? And if you do get it the second time, can you get it worse than you did the first time? And We talked before about antibodies being good for about 3 months or so. So does that mean after that 3-month period, you're susceptible to getting COVID again? If you obviously, if you haven't received the vaccine. Anybody want to handle that question?
Yeah, I'll start handling that question only in that I think let's just start looking at statistics. Yes, people have gotten COVID a second time. There's been handfuls of people in medical journals that have been confirmed to get COVID a second time. And we're not talking about people that have been re-swabbed and that remain PCR positive for months afterwards with a little cold. Some people have, but we're now, at this stage where worldwide we've had, 100 million COVID cases diagnosed or more, and we're looking at a handful of, cases in medical journals. So is it possible? Yeah, it seems to be that it's certainly possible. Is it likely right now? It doesn't seem like it's terribly likely. And now we've been at this since, I don't know what we're believing from China or not, but clearly they were before us. But, Italy since January and February, and us, since March, have really been in the throes of this, and we haven't seen too much reinfection. So, by and large, I think we're getting some protection. The cases that they've described in the medical literature were not significantly sicker on the second time around, and most of them had milder cases, as we would normally expect from a disease that's kind of come around and if you're going to catch it again.
So I'm just going to throw in one question to piggyback to that. If the virus does mutate, can we expect that you are still protected if you have the vaccine or if you've had COVID, or is there going to be a need to get vaccinated every year with it just like the flu shot that we all have to take?
Yeah, so I'll also jump in on this one because I think this always comes down to the flu vaccine, and the flu is something that kind of changes every year on us. It does something called antigenic shift. Not all viruses do that, and coronaviruses in general don't do that anywhere near what flu does. And the best way to think about that is that flu season is like Halloween every year, and you come with a completely different costume, so no one knows exactly what's going on. Some of these other viruses, well, they come to Halloween every year with a gorilla costume on, okay? Some years they have a bow tie, some years they got a top hat, but you always know it's the gorilla. And your immune system knows it's the gorilla and can kind of attack it that way. So, the hope is that with these mutations, that the mutations don't mutate so much that we can't recognize this outside shell, that we don't recognize it's a gorilla, and that the vaccines will kind of continue going on. Of course, time's to be told. We know what happens with other coronaviruses. We don't know exactly what's going to happen with this particular coronavirus.
And just to add to that, completely agree with that. But just remember that antibodies is not our only immunity. Our body has different ways of creating immunity that we rarely talk about, whether it be these cells called B cells, T cells, cellular immunity. So as we don't get influenza every year and pneumonia every year, we have the ability to create an immune system to get multiple types of infection. So antibodies are definitely helpful, but that's definitely not the only way we would fight this. And agree, getting COVID twice in 1 year, it's extremely rare. It doesn't happen in the majority of the cases. And this could be because we have this other type of immune system that's kicking in. At this time, the spike protein and the proteins around it have not yet mutated to the fact that it's fooled our vaccines. So hopefully it continues to stay that way.
We have somebody who's looking more at the big picture, and they want to know, we touched a little bit on it with telehealth, but they want to know if there are ways that COVID-19 has changed healthcare in a more permanent way.
Well, I certainly would say that telehealth and technology is playing a much more prominent role in the healthcare delivery systems. Also, delivering care directly into our communities. We demonstrated that through our use of testing, going out into the communities, where people live to bring the test to them. I think we're going to see more of that. And I also think that management of behavioral health issues is going to become more prominent for all of us as we start to see the results of the pandemic and what it's doing to people's mental health, whether it's depression, anxiety, suicide. So we're going to see a lot more focus on behavioral and mental health issues as well as addiction services. And I think the turn to prevention in medicine is going to be much more prominent, and people are going to be looking for ways to prevent disease much more so than we had in the past.
Anybody else want to answer that question?
Yeah, I'll say that for our system, we've definitely, implemented a great telemedicine program. And for the naysayers, who originally did not really feel that telemedicine was something that they wanted to buy into, wanted to see the practitioner face to face, this forced telemedicine to become, the way of life as we know our new norm. And we found that, a lot of our primary care and delivering telemedicine during this time, people really then saw the benefit and the efficiency behind it in getting care more efficiently and effectively, quicker. And really it's taken on a whole new life. And I think, does it take a pandemic to really bring us to the next, phase of delivering healthcare being through technology and telemedicine? But I have to say it really stood up quickly, and it's we've got some great buy-in, which is it is a really good thing. People are the skeptics are kind of turning.
All right, we are coming close to our hour. I have one more question about the vaccine, and we've also seen reports about people having allergies to the vaccine. There is some concern that what happens if you have an allergic reaction to the vaccine? What if you have autoimmune issues to vaccines? Anybody want to answer that question about allergies? I know that when people are given the vaccine, that they have to, I believe they have to wait there for a few minutes just to be observed to make sure they don't have an allergic reaction. But are there any concerns about allergic reactions to this vaccine?
So I think I can take this question. About the autoimmune question, so there are different mechanisms of how we get allergies. Some people have allergies to egg that's found in vaccines, some of the fillers that are found in vaccines, to certain medications, pills, food. There are different ways we get those type of allergies. There's a difference between an allergy and an anaphylactic reaction. When your face swells and you have tongue swelling and you're actually having not so much of an allergy to the mRNA vaccine, but to what is covering it and what is in it. So right now, the American Association of Allergy suggests that people with food allergies, with medication allergies, continue to take this vaccine because they're not the same thing. If you know that you've had an allergy previously to an egg substance or a vaccine previously, if you're that individual that has to have an epinephrine pen suggested to you by your allergist, then that is a discussion you should have with your allergist. The few patients that were found in the United Kingdom as well as United States to have these anaphylactic reactions, not allergic reactions, were people that already were walking around with EpiPens, suggesting that there was something that they knew they were allergic to prior to taking the vaccine. There are a few cases with people having low platelet counts and severe illnesses following that, and at this point they still haven't pointed to the fact that this may be secondary to the vaccine. We have to wait 15 minutes after you receive the vaccine to check if you have a reaction. And again, there's a difference between a side effect like having pain, bone pain, flu-like symptoms, and an allergic reaction. So I think we just have to a little bit differentiate. So just because you have an autoimmune disease like lupus does not mean that you cannot get the vaccine or you're going to have a anaphylactic or a full-blown reaction. So I think we have to differentiate. And if the question is there, you must speak to your allergist regarding that.
Thank you, Dr. Cholankeril. So we are at exactly an hour. I just wanted to wrap up. From what I've heard, we have to continue to wear our masks, continue to wash our hands, continue to social distance, continue to get tested, especially if you feel sick. But the good news is that there is light at the end of the tunnel with vaccines. And the other important point I heard was that you have to make sure you continue to take care of yourself and not let other diseases get you before COVID does. So keep going to the hospital, keep making your doctor's appointments. Hospitals are safe places to go. You won't catch COVID at your local hospital. With that, I want to thank the panelists for participating in tonight's discussion. I think it was really informative. Dr. Perez, Dr. Cholankeril, Lori Colineri, who is, by the way, a doctor. She's a nurse, but she has her PhD. So I wasn't sure if I should have called you a doctor because I didn't want to confuse people, but you do have a PhD. Deborah Visconti and Dr. Don Liss. Thank you very much for participating. And I also want to thank our sponsors, Atlantic Health, our presenting sponsor, Bergen Newbridge Medical Center, Horizon Blue Cross Blue Shield, Prime Healthcare in New Jersey, RWJBarnabas Health, and Trinitas. I hope you enjoyed this virtual discussion about COVID-19. There will be a link to tonight's, it was recorded, and there will be a link available, and it will be emailed to all, everybody who signed up. It'll also be on all the TAPinto sites. TAPinto looks forward to presenting future events on issues that affect folks locally. Their next virtual event will be held on April 13th. It's going to be about a completely different topic, real estate. We'll have TAPinto will have more information about that in the coming weeks. So thank you very much, and I hope you enjoy the rest of your evening.